Today, joining us from Big Sky Medical Center, we have Taylor Rose. From the Big Sky Chamber of Commerce and Visit Big Sky, we have Candace Strauss. A leading healthcare industry venture capitalist, Gary Rochelle. From Big Sky Relief Fund and the Big Sky School Board, we have Lauren Bao joining us. A sixth-generation Montanan and businesswoman, Whitney Williams. And from Big Sky Resort Area Tax District, we have Kevin Germain and Danny Burschwal. So with that, I'd like to welcome our first panelist to the stage, Taylor Rose. Taylor, thank you for joining us today.
Hi, thanks for having me.
Wonderful. First off, on behalf of, I know a lot of people say this, everything that you and your team are doing and being on the front lines of the medical situation with this, we are eternally grateful to all of you, and to know that we've got such an incredible resource, not only in our region, but now in Big Sky in our backyard. Thank you.
Yep.
Let me dive right into it. What is the current state of COVID situation in Big Sky and our immediate region? We get plenty of news, I think, on the nationwide scale and the world scale, but how would you bring it local for us? And you know, in particular, the question we get asked a lot is any insight to the numbers and what's happening in Big Sky?
Yeah, the numbers that we share are just what the county health department is sharing. The county health department told us that, you know, they're going to be the ones to disseminate. So we're sharing on a level that the current status from the Gallatin County numbers are what we share, and then any hospitalized patients from Bozeman Health will be shared at that level. You can imagine we like to protect patient privacy and everything. So those are the numbers we're currently sharing, and right now we have no hospitalized COVID patients at either Bozeman Health Big Sky Medical Center or Bozeman Health Deaconess Hospital.
Great. When you look at some of the curves that are out there, in particular the IHME curve, it predicts that they predict COVID's going to peak here in late April. How does that line up with what you guys are seeing, or do you guys run your own internal predictions or projections on how we're doing as a county or area?
Yeah, we're currently managing kind of one day at a time here. It's an ever-changing situation. We're evaluating the curve. We're trying to minimize the curve, obviously, by taking certain health precautions into effect, the visitor restrictions and social distancing precautions that we've put in place at Big Sky Medical Center and around all of Bozeman Health, reducing non-urgent surgeries and canceling and postponing elective procedures and visits. So we are looking to reduce that curve. We're not quite comfortable to say like where we're at the curve, because it's kind of hard to tell every day, but we are confident in our ability to address the current situation and where we're at. We are confident in our staff and our capacity right now. Excellent.
So I was going to kind of dovetail into, you know, being able to handle patient load in Bozeman and Big Sky, and it sounds like that hasn't been an issue right now. Has there been any additional protocols? You mentioned that you have changed some of the protocols at the hospital. Any other additional protocols in your medical facilities that you'd want people to be aware of? Any changes?
Yeah, currently we have some visitor restrictions going on that people should be aware of. It basically boils down to we are not allowing visitors in the hospital, emergency department, or the clinics or if beds. There are some compassionate exceptions to this, and some obviously pediatric, juvenile exceptions. If the patient is under 18, they can have one visitor to accompany them. And there's some compassionate ones as well, as far as if the patient needs a visitor for specific health reasons, or if end-of-life care, those types of things. But the basic message is we do not have any visitors at our facilities right now. We'd encourage those that are seeking care to seek care, but visitors will be asked to not visit. Any person coming into our facility will be screened by a professional with a thermometer and asked some screening questions. And we're not allowing anybody who's running a fever to be in our facility unless they are seeking care. And if you do screen positive for any of our questions, you'll be asked to visit our up-and-coming viral triage clinic that we should have up and running by the end of this week at the latest. And it's 3 rooms that we've set aside to treat these patients and to help them stay away from the rest of the campus so that we can still have those visits being seen, and people can still seek care, kind of knowing that they are separate from those people being triaged for viral diseases like COVID or the flu.
And is that triage clinic, is that something that's in Big Sky or is that Bozeman?
That is in Big Sky. We should have that up and running by the end of the week in Big Sky.
Okay, excellent. At this time, does Big Sky Medical Center have sufficient testing, PPE, ventilators, a lot of those hot button topics that you're hearing discussed on the national scale?
Yeah, we feel confident in our supplies right now. We have some additional ventilators thanks to the generosity of the community in Big Sky, that we've got 10 ventilators coming to the system. 3 of those will be coming to Big Sky Medical Center. Our current ventilator count is 1, so we'll be quadrupling our ability to do ventilators. And we're also building out 4 additional inpatient rooms that can help us address the patient needs up here. Those should be constructed by about May 5th is the current timeline, but you know, those construction timelines do change. But we do feel confident in our current ability to address those, and we are preparing for an even higher demand from the community, and just really trying to beef up our ability to address this COVID situation. But right now we do feel confident in our ability to address it.
Excellent. Before I turn over to Joe, just to see if any of our audience had any questions, do you have any needs or requests from the Big Sky community? I mean, anything beyond equipment, but just in terms of, you know, us all in this together, any requests of the Big Sky community?
I think that, I mean, the message that you hear everywhere is stay home, stay away, and stay away from people. We want to be the resource for care when people need it. And so if it's a general, if you would be seeking care based on your symptoms, please call in and ask, you know, ask some questions. This is what I'm dealing with. Can I come be seen? We'll kind of triage that and evaluate if a virtual visit is best for you, or if you do need to be seen on site. And of course, and as always, if you're experiencing an emergency, please dial 911 to get that care. They can get you to us. Emergencies always we want to take care of. We just want to keep people in the right frame of care and make sure that they're receiving the right level of care in this situation. So.
Excellent. Well, I appreciate that. Joe, is there anything from the audience you'd like to bring up?
Yeah, absolutely. Thanks, Eric. And thank you, Taylor, for joining us. We really do appreciate your time.
Yep.
We've got a question from Maggie Good. It says, Bozeman Deaconess is significantly smaller than hospitals in Billings, Missoula, and Great Falls. Is there a plan to transfer, if needed, to some of these other locations?
Bozeman Health is working regionally with the health departments to look at the bed availability across the state, and we participate in a collaboration where we submit all of our beds on a daily basis, what we have available, and that goes into the state where they're able to look at the availability across the state. So we are participating in that, and if the need arises, we will be, you know, sending patients to other locations. The level of care that we're able to provide is that ICU level of care that you would find in other locations down in Bozeman. So as a capacity, once we hit capacity, we would probably be looking to our partners in the community and across the state to help us offload some of those volumes. We do, you know, Gallatin County is getting hit harder with COVID than other parts of the state, so we would lean on those partners across the state to transfer patients if need be. And we feel confident in our relationships with them and our ability to do so.
Gotcha, thank you. We've got another question here from Diane Bartik. Can we get our doctors not dealing with coronavirus patients to have office hours up at the Big Sky Resort Clinic? We still need to receive our health needs and have those attended to. Any response there?
Yeah, our doctors that are not dealing with the coronavirus pandemic, sorry, not epidemic, but they are currently still seeing patients at our clinic here in Big Sky Medical Center. We are trying to shift as much of that out to a virtual visit as possible. If the doctor does need to get hands-on and they do need to see you, they will be asking that you come into our clinic. And part of I mentioned earlier, the viral triage clinic that we're setting up is to help enable our doctors here at the clinic to see those patients without worry that they're going to be mingling with our viral patients that we might have coming into the facility. So there's a shed that we've placed outside the front entrance that will screen and triage patients to either, if they're part of the viral clinic, they'll be asked to go around and use a separate entrance. And then if they're being seen in the clinic for lab, for imaging, or for just seeing the doctors in the clinic, they'll be allowed to go in the main entrance.
Mm-hmm. Understood. Thanks for that. One last follow-up for you. So at last Friday's Big Sky Relief Fund meeting, you mentioned local production of reusable masks. I was wondering if you could elaborate a little bit on those developments.
Yep. So our foundation is coordinating all the community donations that we're getting, and part of those is down in Bozeman, there's been some groups that have gotten together. They've worked with our healthcare system, and they've developed a mask that can be washed and reused to help hopefully offload some of the needs that we're seeing for our disposable masks. We're also, Sims has been the clothing and fishing wear, Sims, has been gracious enough that they're going to be developing reusable gowns that we can put on and help protect us as personal protective equipment, PPE, for the hospitals. We've seen just a lot of community donations of these masks and gowns that people want to help out, and they're all being ran through our quality and safety department that's in our incident command structure to make sure that they are addressing the actual need. And so if there is somebody that has, you know, the ability to produce in a large quantity some of these things, I'd have them reach out to our foundation, the Bozeman Health Foundation, and they can coordinate how to make sure that they meet our needs and that they're useful and we can utilize those to go forth.